and thank you for attending our Global Change seminar today, and welcome back if this is the second seminar in our series you're attending. Today we're going to keep on that theme of exploring environmental challenges during a global pandemic, but specifically this time we'll be focusing on disaster recovery. And so if you're an attendee, we ask that you remain muted and keep your video off. That should be happening automatically as you're entering the room, but just to make sure, if you could please do that, that'd be great. And today's panel will actually be a special extended session that will go until 4:45. Some of us, such as myself, are students that might be logging off around 4:30 for class, but I'll be leaving you in the very capable hands of my co-moderator, Jin Bai. And we're going to keep this discussion rolling. Thanks to the audience analytics from Sam, we see that the majority of us are NC State affiliated, but we have about 30 or so from federal agencies, nearly a dozen tribal nation members, and even some special private sector representatives. So I think we're going to have a pretty lively discussion. It feels pretty pertinent given the uncertainty I think we're all feeling in the US right now as we await these election results. So I think that kind of underscores some of the pandemonium that goes on with disaster response during a global pandemic. So now I'm going to hand it over to Jin to introduce our really special multidisciplinary panelists.
So we are really excited about the panelists who are joining us today. Professor Andy Fox is a university faculty scholar, Center for Geospatial Analytics faculty fellow, and community engaged faculty fellow at NC State University. Dr. Kristin Ludwig is the science advisor for risk reduction at U.S. Geological Survey Natural Hazards Mission Area. Dr. Pablo Mendez-Lázaro is an associate professor in the Department of Environmental Health at the University of Puerto Rico. So we also have one more speaker from Dr. Amanda Martin. She may join us later. She is the Deputy Chief Resilience Officer with the state of North Carolina. So first, I want to ask each panelist to briefly elaborate what is your role and connection to disaster recovery. How about starting with Dr. Kristin Ludwig?
Good afternoon. Thanks so much for the opportunity to join you all today. I really appreciate the invitation and I'm looking forward to the discussion. As Science Advisor for Risk Reduction at the USGS, my role spans a wide portfolio of looking at how we can best apply our science at the USGS to reduce risk and improve community resilience across multiple and all communities. I've had the opportunity to contribute to disaster response and recovery to a wide variety of hazards ranging from Hurricane Sandy and most recently the 2018 Kilauea eruption, and I'll provide some examples of that in my comments. And I also have the opportunity to serve on multiple interagency committees that are focused on disaster response and recovery. Thanks.
Next, Andy Fox.
Good afternoon, everybody. Thanks for having me here today. I look forward to the conversation. My name is Andy Fox. I'm a professor in the Department of Landscape Architecture and Environmental Design within the NC State College of Design. And part of my role there is to co-direct the Coastal Dynamics Design Lab. And we are a small initiative that actively works out in Eastern North Carolina on ecological and community development challenges. And so really being guided by those communities in terms of what each of them needs. So very much a bespoke process that we work through in terms of our engagement. We've been doing work in resiliency planning since about 2013 in Eastern North Carolina. And more recently, since 2016, we've been working since Hurricane Matthew, Hurricane Florence, and others on rebuilding as a part of that process. And that involves many other folks that might be familiar to some of this group in our faculty, Kofi Boone, Gavin Smith, Chilin Pasilar. So very fortunate to be in a faculty cohort kind of focused in the community aspect of this realm.
Next, Pablo.
Hi, good afternoon. Thank you for inviting me. I'm Pablo Mendez-Lázaro. I'm an associate professor at the Department of Environmental Health and the University of Puerto Rico Medical Science campus. I've been involved in multiple research projects during the last decade, analyzing impact of extreme weather events and atmospheric events impacting public health and socio-ecological systems. Therefore, when we had the experience of suffering the hurricane season in 2017, I was able to design and build a public health brigades, not only for Puerto Rico, but also for US Virgin Islands and British Virgin Islands. And we were working as liaison with different NGOs and the university and the state government and federal government, not only providing supplies, but also medicines and physicians, because a lot of people in rural areas were not able to get there. And so because of our experience working with communities on extreme weather events, such as droughts, hurricanes, or coastal floods, we already knew what to expect in some communities of Puerto Rico. That's it. Thank you again for inviting me. Very happy to be here.
Yeah, thanks for that description to all of you. And now, Dr. Lázaro, given that you've been the PI on a number of climate resilience projects for vulnerable communities, what would you say are some of the main challenges, I guess, that you face in disaster recovery work?
To me, Pablo.
Yes. Oh, yes. Okay. Should I just say Pablo?
Sorry. No, don't worry. You can come. Yeah, you can use my name, please.
Okay. Great.
I feel old. Well, I think that at least in my opinion, right, we have so many challenges dealing with COVID-19. But in my opinion, I think that just the natural behavior of this kind of threat is already a major challenge. And the second one will be to distinguish between reliable information and accurate information, right? We are very used to work with, at least from my side, for example, with some extreme events that are can be analyzed in duration, frequency, and magnitude and intensity, such as hurricane, earthquakes, those that are hydrometeorological related or geological related, because they are more often. So we are more related with those kind of hazards, those kind of disaster. We're dealing very often, at least in the Caribbean, with those kind of things. But with pandemics are not that frequent worldwide, right? Not epidemic or pandemic occurs every decade, every half a century. And so it is very different in the way that we can prepare, respond, and all of the different phases for disaster management, right? COVID-19 per se, we can consider it as a major disruptor. It's already impacting by nature public health, is increasing mortality rates, emergency room visits, hospitalizations, not even in Puerto Rico, not also in the United States, but worldwide. It's a pandemic, right? But it's also impacting the economy and life concurrent activities. So in my opinion, we can consider it a disaster by itself, right? It's affecting social behaviors, it's affecting laws, regulations, mobility, school, everything, right? Exactly like an earthquake or like a hurricane, right? Unlike hurricanes and earthquakes that can't last a couple of seconds or a couple of hours like hurricanes, pandemic can't last for months and years. And we just need to look back to many other pandemics as HIV, for example. HIV started in the 1980s, and we're still facing with that, with HIV, right? It's not over yet. We have been invested a lot of money. We have been working on that, a lot of research, a lot of essays for vaccines. But we're still not there yet, and the situation is a little bit under control, but it's very still we are learning from it. Okay, so just the natural behavior of this threat is a major challenge. And the second one that I would like to highlight is the access to information, right? Reliable information or accurate information. To overcome a disaster, there is a reality. We have government officials and decision makers contradicting scientific information, right? And we are seeing this not only in the United States, but in many other countries. I'm not gonna go into that detail, but let me put it in this case, in a hypothetical scenario. Let's assume that the National Hurricane Center is forecasting a hurricane category 5 approaching the Florida coastline within the next 2 days. But prior to making landfall, you have state government officials that can start contradicting scientists and providing confusing information, right? So what will be the reaction of the population once you have scientists telling you one thing, but in the other side, you have government officials who you trust, right? Because those are your leaders telling the opposite, exactly the opposite. So who to believe, right? So this is like we are in a battle between science and decision-making. This is not new. I'm not saying this is new. It occurred forever, even in the Middle Age, when the church and the scientists and astronomers and all the explorers were contradicting the church decisions and the leaders. So, but again, I think that those are two biggest challenges that we have: reliable and accurate information, and the nature and the behavior of this kind of disaster by itself, because it could be long-lasting in terms of dealing with disaster management. It's not going to be in the next couple of days that we're going to pass to the recovery phase. We are still dealing on the response phase.
Thanks. That's a really great response. And then to go off that, Dr. Ludwig, you're a scientist for a government agency. Do you ever encounter some of that like miscommunication divide between the more purely safe, not to put you on the spot, but or are there other challenges that you deal with that you would say are more, more pertinent?
Certainly. I think we all as citizens of our country have witnessed some unusual examples of the spread of misinformation and the challenge of messaging risk and hazard during the COVID pandemic. And I think I'll pile on to Pablo's comments in terms of some of the challenges that we're facing. And he makes an important point. We are still in the disaster response phase of the pandemic. We haven't, as much as we want to move on to recovery, we haven't moved there. But that said, I think with any disaster, one needs to be thinking about recovery at the same time as response. It's a necessary part of the process. And I think two challenges, in addition to what he mentioned that we face, include compound disasters, and I'll explain that in a moment, and cascading consequences. And with compound disasters, I'll share a story. Early in the pandemic, around April to May, I was attending several interagency meetings where many of us in the federal hazard science arena were asking ourselves, how can we prepare for the inevitable concurrent or compound disaster, where multiple disruptions are occurring simultaneously and synergistically? At that time, hurricane season was around the corner, fire season was around the other corner, it's always earthquake season, and inevitably there are disruptions that we know can happen at a moment's notice, but we can't predict. So as federal agencies, we were really trying to determine how can we anticipate the science needs for disaster response and recovery across multiple concurrent events in the midst of a global pandemic. And in retrospect, some of these conversations were a bit quaint. At the end of the day, we still have only the same number of people, or perhaps even less due to COVID, for responding to these. And so even at USGS, we've had to exercise a lot of creativity and flexibility in responding to all the events that have happened in 2020, in addition to the pandemic. We've seen hurricanes, earthquakes, floods, wildfires, and others. And I think at a broader scale, it's illustrated that in many ways, we as a society it's really hard to wrap one's head around compound events, and it's exhausting. And I think it's becoming more common. And so this is I would say for all of the students, there's some important opportunities arising out of this for how we think about both preparedness, response, and recovery to these compound disasters. Even this summer, there's been new attention on all levels paid to this concept. In July, there was a letter from several House representatives to the White House asking the White House to direct federal agencies to prepare for responding to different types of disasters at the same time in order to better support communities. In the interagency, we've had multiple conversations on how we can work together as the federal family to prepare and communicate these events, and really what does this mean for risk assessment and mitigation. And even in academia, the National Science Foundation funded Converge Initiative funded a total of 90 different working groups focused on public health and social sciences research around COVID-19. And I've encouraged all of you to look at some of the research agendas that they adopted. They do address the issue of compound disasters during COVID. Intertwined with that is cascading consequences. And this is when you have one event that leads to another that may lead to another. And at USGS, we develop hazard scenarios. Many agencies do this. Similar to war games, the goal of these scenarios is to play out different situations in order to anticipate how one might respond to some of these different cascading consequences. I have not had the opportunity to work on a COVID-19 scenario specifically, but what we see is that the same principles that we apply to other hazard events apply to the pandemic. There's always cascading consequences. And I think, again, as citizens, we've seen examples of that. The disruptions in our supply chains due to COVID have impacted our access to different resources. Even specific things, disease outbreaks at our prisons have hampered the ability of prison wildfires to support a record-breaking fire season. And I think in terms of recovery, as we sort of start shifting, hopefully, from response to recovery, the question that remains is, what are the other long-term cascading consequences we haven't seen yet, we haven't thought of yet, that are going to really come to the fore down in the future? And I think that's a remaining challenge, and perhaps from an academic perspective, perhaps an opportunity.
Thanks. Thank you, Dr. Ludwig. While she was giving her great response, we had Dr. Amanda Martin join us, and she is a Deputy Chief Resilience Officer with the state of North Carolina. So welcome, Dr. Martin. We've just been talking about what are some of the major challenges to disaster recovery during COVID-19 or any global pandemic, and one of those also being kind of the miscommunication between agencies and audiences, or the importance of communication. So I don't know if you have anything you want to add onto that right now, or we could go to Andy while he gives his answer.
Sure, why don't you let Andy go and I'll collect a few thoughts.
Sounds good. Yeah, I was specifically curious, or Professor Fox, when we were discussing that you're talking about the rebuilds of Hurricane Matthew and Hurricane Florence, and I was wondering if you had to do one of those projects during this time, like what would be kind of the unique challenges you would face there?
Yeah, actually, we're in the midst of a number of those projects right now, some of them starting prior to the pandemic and others starting after. And so it's really interesting in terms of how we're kind of reflecting on the ways that we work. This is really, all disruption creates innovation. And so what's really important is to reflect on what has worked in the past, what needs to shift in the face of some of the challenges. And so for our work, we're looking at both short-term and long-term rebuilding and resilience initiatives. Our work is traditionally involved in situ engagement, and that is extremely challenging, as you might imagine, especially for us coming as my primary role in the academy. So I have to work through those rules that are laid down not only by the state but by the university in terms of how we're kind of let loose to do our work as well as safely as possible. So that from an administrative role, right, requires all kinds of adaptability. We have to be agile in that space to be able to figure out ways. And so for us, some of the biggest challenges with engagement are, we have to learn from local expertise. One of our mantras is that we bring in technical expertise, but residents are expert in living there. They understand their community. They know so much about it through just the lived experience and the kind of knowledge that comes along with that. So how do we continue to learn from that and not work in kind of the this vacuum in which we can follow our own assumptions to maybe false ends or destructive ends in that way as well. So authentic engagement requires building relationships. And so we're trying to find now ways to be able to continue relationship building. So our projects that started before the pandemic, in some cases, we've been in those communities between 3 and 4 years now, nonstop working. So we've built trust. We acknowledge that we're outsiders in most cases. We do not resemble or mirror the communities in which we work. So to be open and to that we can't hope to know the challenges that those communities are facing, and really thinking about co-production. Kristin brought up the Converge grants. Actually, it was part of one of those this summer, which is really about co-production or co-design with communities in the age of COVID. And so, topics that a lot of really smart folks are working on, and with no easy answers. So we have restrictions on gathering size and location, right? So that affects how we might think about engagement. Also, people feeling safe coming out. So if you fall within a group that is more vulnerable to COVID, or if you have family members that are, will you come out? Are you really hearing from folks that you need to be hearing from in that way? Also, people coming out, and not everybody respects the same protocols. So, how do you work through that? And then also access to technology, and relatedly, the access to robust and reliable broadband. And so we're working out in rural communities that, it's one thing to say, let's have a Zoom meeting. Well, I'm sure everybody on this call has been either, part of a call or the one who's had their system collapse during that time. And so really thinking more broadly about access, just generally defined, is equitable access to these resources that we're going to have moving forward in kind of a post-COVID world. And so those are some really big challenges that we're facing, is innovation of engagement and thinking about how it can work. A little bit later in the discussion, I probably share some examples about actually the benefits that come out of this. Again, there's always unintended things, good and bad, that come through it. And the last thing I'll note, just because Pablo raised the point, and it's a really good one, that this idea of acute versus chronic threats and is really important. And so acute weather events tend to reveal chronic and systematic issues within communities. And so in a place like Eastern North Carolina, there's a lot there that has to be unpacked, from plantation economics and the post-slavery and Jim Crow period to health disparities, wealth disparities. And then again, all these big weather events bring all that kind of flooding, no pun intended, onto the surface, and you have to contend with them all. So I think what I really appreciate about this event and all the folks that are attending this event and others like them is the need for interdisciplinarity. These complex challenges really require engagement at all levels. So with communities, but also between scientists, designers, engineers, policymakers. It's about having the most complete team as possible to think through both the pitfalls, but also to really kind of move into new territory, because I think we have a pretty good idea of what doesn't work based on a whole lot of evaluation of kind of past work. And so I think these discussions are really, really important to create a network, and really building kind of an action network around the issues is to build a team that's capable of getting at the problems.
Yeah, thank you. I think accessibility is a really simple but profound point. I know even earlier just when we were waiting for the seminar to begin, you and Pablo were kind of relating about how you're also sharing bandwidth with kids at home, and that adds a whole nother layer of dimension that, you know, that just didn't have to happen before we were in this new stage of life. But yeah, I guess Dr. Martin, would you have any challenges that you'd like to add that you've noted that are coming up right now?
Sure, yeah, I'd be happy to share some. And I apologize for being late. I was just 15 minutes behind the rest of the world, apparently.
Yep, it happens.
But so I do a lot of work on housing recovery and housing resilience specifically, and I have a few things to share about challenges. And then I think, like Andy, I actually have a few opportunities that I think about as well, that I can talk about later. I think one very concrete way in which the pandemic is making recovery more difficult is that a lot of our housing is rebuilt by volunteer organizations. We have a number, most are faith-based in North Carolina, or even, you know, across the country. They're, we call them VOAD, Voluntary Organizations Active in Disaster. And their primary set of volunteers are retirees. And guess who does not want to come out and rebuild a home with 8 other people in the middle of a pandemic is a 70-year-old retiree. And so they're having a really hard time. They already had difficulties recruiting volunteers. It gets progressively harder. People have that, we all have short attention spans. And it's no different in a disaster. And so there tends to be a lot of volunteer labor right after a disaster, but there continues to be a lot of rebuilding that needs to be done. And the volunteer organizations in our state are really strapped for volunteers right now because people don't feel safe, and it may not be safe. I want to make sure to, you know, present that part of it as well. You know, it's not just a perception. Another way in which the pandemic has made recovery more difficult is that my organization, the Office of, this is the State Office of Recovery and Resiliency, runs a number of home rebuilding programs. And in order to be eligible for these programs, you need to hit a certain set of eligibility criteria, including income criteria. We prioritize low and moderate income homeowners, but also the kind of damage that you have, other kinds of eligibility criteria. And it's a complicated process, and it's complicated when you can do it in person. And it's really complicated if you are just calling up and trying to get someone on the phone who can walk you through it. And so it's been really difficult to shift. We had in-person disaster recovery centers where we did intake for all of our potential participants. And with COVID, we had to close all of them and go all completely online and by phone. And I think for those of us who are probably, maybe most of us on this call today are very comfortable with technology and you know, using these kinds of online resources to get things done. But for someone who doesn't do that all the time, like my parents, for example, maybe your parents or grandparents, it's really, really difficult. I mean, my dad cannot buy a plane ticket online. I have to do it for him. So imagine trying to go through and demonstrate validity of your, you know, the title to your house. It's just really difficult. And we have been able to shift some of those back to in-person with social distancing. But I just want to kind of give some concrete ways in which the pandemic makes it difficult to do recovery. And then I guess one thing I would share about housing that's a little bit more holistic is that with COVID, we're having an economic crisis, and with the economic crisis, that immediately translates into people's ability to stay in their homes, whether you're a renter facing eviction or whether you are a homeowner facing foreclosure. And our housing organizations before COVID, before Hurricane Florence, before Matthew, were already really maxed out for their capacity. They've had their budgets cut over the years by the state legislature. We have very little affordable housing with respect to our need in North Carolina. And there's not a lot of development interest in a lot of the areas that have been most impacted by flooding disasters in recent years. And so there's just kind of, COVID has created this additional layer of pressure on our housing support systems. And just I know our organizations are literally, they're at max, but they're facing budget shortfall. So they're actually cutting housing counselors, the kind of people that can help homeowners stay in their homes. So, at this point, we have a number of policies and programs that are, when pieced together, trying to keep people in their homes, whether they're renters or homeowners. But we know they're not going to last forever. And we're already seeing a lot of housing crises. We know we're going to see more. So kind of this overall state of not enough capacity, not enough resources for housing in the state. Just kind of like adding another disaster into the work that they're already doing to try to get people back into homes and rebuild their homes has been a major challenge.
Thanks for those really detailed answers. Now I'm just kind of wondering, I guess, are there any benefits that have come out of trying to do disaster recovery during this type of pandemic? Or are there any lessons we can take away from like the type of, how we've had to switch from the usual way you would communicate with the impacted communities, or if anything like that comes to mind? You're nodding, I don't know. Dr. Martin, you want to keep going?
Sure. Yeah, I can talk about a few of those kind of opportunities or realizations. I'd be interested to hear what other panelists have to say as well. I think one interesting element is that at the same time as we've been really worried about broadband access and people who do not have access to broadband, I think the pandemic has forced some additional technological literacy onto a population that we wouldn't have been comfortable pushing it on before the pandemic. And I guess what I mean by that is there are a lot of community leaders that are using Zoom, and it's much easier to build relationships with folks, with a community leader who might be located 4 hours away from myself in Durham. And previously I would have felt like, out of respect, I wanted to go meet them in person. That's how they prefer to interact. And I maybe would have met one. And now, because people are sort of forced to use Zoom, it's possible to meet 14 community leaders in one meeting. And so there is this, and I don't, there are people for which it's really much more of a barrier than an opportunity, the Zoom world we live in. But there have been some opportunities. And I also, I guess for me, it's really made clear how the work I do in climate resilience and natural hazards resilience relates to other kinds of resilience, because as we start to set up response and recovery programs for COVID, I see which of the same capacities and which of the same relationships are being used to build those programs in response to a totally different disaster. And so it's really highlighted for me the aspects of the work that we do that are most foundational, and that those are the aspects that are most adaptive to whatever disaster is going to come next, which we don't know.
And then thanks. And Pablo, do you kind of find that to be a similar situation in Puerto Rico, or has it mostly been a divide to have to deal with the pandemic on top of disaster recovery?
Yeah, definitely. First of all, I would like to say that I agree with all of the comments that all of the speakers have mentioned before. I think that we are all aligned in our thought. So I think that we are still learning from this pandemic, and since we were forced to react so quickly, the learning curve for physicians, for decision makers, for government officials, for scientists, but also for society in general, have been so steep that we have learned a lot, right? As Andrew and I were talking right before starting this meeting, we just learned how to deal with, I thought before having homeschooling my kids I thought that I didn't have time enough to survive with my work and my life concurrent activities, right? But I was wrong. Now I'm doing almost exactly the same things. I'm still working, I'm still doing some kinds of activities, not in close, in indoors environments, but at least in some other places. But I'm also doing homeschooling with my kids. And believe me, it's a challenge, right? So yes, we are learning. There are a lot of opportunities within this pandemic. Is a very sad component because some people and some part of the society are learning, but some others are suffering, right? The reality is that in most of the disasters, disadvantaged communities are the ones that suffer the most, right? And in some cases, the government doesn't have the capacity to transfer the information in an effective way in order for the community to improve their decisions, right? So I think that that's another kind of learning experience that we need to adopt. I'm bringing an example from Hurricane Maria. Thousands of NGOs outside of Puerto Rico entering Puerto Rico and US Virgin Islands right after Hurricane Maria, right? And we were very grateful for that and we were very happy. But without coordination, it could be overwhelming, right? So then it was a discoordination between the federal government, the state government, not only the community-based organizations and the residents and neighborhood, but also in the middle of that, you will have some other new actors in the middle with willing to help, right? And this is something amazing, but without any guidelines, right? So it was overwhelming, not only for the government and for the community-based organization, but even for the residents. And bringing it to the more specific example, without this kind of information, for example, one community that is not needed for paper towel, for example, let me say that, you will receive like 3 to 4 to 5 trailers full of paper towels to your community, right? A bottle of waters, but perhaps your community didn't need any kind of water, but the community nearby needed, right? But without that kind of information, it's impossible. And sometimes the government doesn't know, it's lacking about what kind of information the community is needing to improve those kind of decisions, and to improve the decisions for them to improve, to avoid any potential contagious with the disease. Another important component that I think that we need to learn is how to communicate. At least in Puerto Rico, it took us like 5 months to start developing educational material for COVID-19. That's, I don't know why, I don't understand why. It's amazing. But what we were receiving from the government officials were numbers and statistics. But it's sometimes impossible for communities to make decisions out of statistics, right? You need to receive some suggestions and potential solutions, right? That you can handle that information and use in your advance. But only given information about the transmission rates, the mortality rates, the number of beds that were occupied in hospital, and the number of people that were in intensive care units, that's not enough information. Sorry, let me clarify. Don't get me wrong. That's a lot of information, right? That's a lot of information. And perhaps for scientists and decision makers, but that is not the specific information that communities need. So we need to learn also, that's an opportunity to improve, right? We need to learn and what kind of effective information we need to disseminate and how to disseminate it. That's another issue. What are the channels of communication? Winning the trust of the community, that's a challenge as well. And so what we have done, for example, working with community residents and community-based organizations, are identifying anchors organizations that are already working with the community and with the community residents already trust, because most of the community resident doesn't trust the government at all. So if we want to get access to the communities, even if we want to share some infographics or I don't know, or graphical table or whatever, we need to have some channels of communication. and those channels of communication not necessarily exist between the academy and the communities, or the governments and the communities. So there are many other levels of people in the middle that have more access to that it could help to be more effective in doing your communication. So I think that's an opportunity we need to learn also. There is a lot of other kind of opportunities, right? In science, implementing new treatment, implementing new protocols, and developing vaccines. So there's a lot of other opportunity, but I will let the others to speak as well. Thank you.
Yeah, I don't know if you guys want to jump right in, but that did definitely make me wonder as Pablo was talking, is it that we need more people, more liaisons in the middle to go from the academics or government agencies to the vulnerable stakeholders, or is it that we just need maybe like some more accessible like graphics or information to like flow from those agencies to the people? So I don't know, Kristin, you want to speak to that or have any examples of that?
Yeah, I can provide a couple of examples, and I think in short, we need all of that. And this is something that within, at least I think the climate community is advanced in this, but in hazards, we're starting to really focus at USGS on the co-production of science. And how do we, as a federal agency, we're not always popular as a federal government in different communities, how do we make those key connections, as Pablo described, with community-based organizations, community leaders, at a national scale, which is the scale that we work at. And that's something that we're really wrestling with right now. And yet we understand the importance of creating those relationships in order to effectively deliver science to improve risk reduction. And so with our new risk initiative, this is something that we are incentivizing with our scientists through a request for proposal process where we require attention to stakeholder engagement and co-production of science. I think we'll get into this later in the discussion, but we have a new diversity and equity component to the RFP this year to start driving work in that arena as well. But I think one of the challenges two challenges we're finding in doing that work. One is it inherently involves the people component of science. And we have very few in-house experts in the social sciences at USGS and even writ large at the Department of Interior. The ones we have are outstanding, but we're finding we can't meet the demand. The questions that our scientists are asking of, what are the best practices in stakeholder engagement? How do I find a partner in this? Or to what Andy was saying, how do I effectively create these relationships and conversations in a virtual environment? So we're kind of building the airplane as we fly it with that, and looking to learn from others who have tread this path before and apply that. And I think, again, there's a lot of opportunity there for that truly multidisciplinary science and problem solving that does require not just natural and social scientists, but as one of the speakers said before, the integration of engineers and designers and community leaderships, and the recognition of that need for a holistic approach to these. And I think one of the unique things about the pandemic is, unlike many of the other hazards, at least in my group that we study, they're usually somewhere else. They're in California, they're in Puerto Rico, they're somewhere regional where they're having that impact. And what's unique about the pandemic is this is a shared global experience. And so there's a new part of, I think, both empathy and sympathy that we have to observe, to learn from, and to take advantage of as we think about recovery for future events.
Yeah, I think that empathy component is really something that's like looming large right now. But we have one of our first questions from the audience. Alicia Tyson would like to ask to all the panelists, how are you all approaching or navigating the challenges, but also advantages of team science? Maybe Andy, you could start us off with that one.
Yeah, you're giving it to the non-scientist in the room.
Team architecture.
Well, I think that's important part of this conversation and building on even the ability to communicate, right? Is that where are the designers, the graphic designers, the VR designers? How do we start to make this like an actual visceral experience in real time when it's not a disaster? To do education, walk through some potential adaptation strategies, which is a big part of what we do. Is we, as non-scientists, so I'm a researcher but not a scientist, so that might not make sense to some folks on the call. I'm a licensed landscape architect. I come from practice. I'm a non-traditional academic. But what we love to do is synthesize all the buckets of the science. We kind of bring in that data and then we lay it out and try to understand it in real time in the built environment. And so there's lots of ways to look at that information. I'm a built environment professional, so we like to look at regional scale, city scale, neighborhood scale, scale of a house site. We can look at all those different scales of time and space and try to assess what could happen. And so I think to the points that were raised earlier, a lot of the information that comes in, the data points, it's very hard for the lay public and to understand the so what of that information. So what does this mean to me as a homeowner? What am I supposed to do with it? And not only that, but even if I understand what to do with it, where do I start, right? Is there a process that you can help me understand that I need to take? So that's what we do in our work for the few communities that we're able to work with based on our own capacity, is to try to work through that. And it takes a long time, as you can imagine. And so I think that's, again, back to this idea of interdisciplinary teaming, is bringing in folks that have amazing wealth of knowledge in science, but then those who are in the social sciences, the humanities, design, kind of all over the map, and understand what's the best way to really explore the full breadth of the issue here. And let's see if we can get at that, and then unpack it and then repackage it. And so an analogy that I had to give someone about the role of design in this is that we're not solving a puzzle. We're literally designing the puzzle that then we're going to ask people to solve. And so it's like, it's a challenge because the puzzle doesn't exist yet. And so, but science is guiding us there, right? All this data and information is informing us what's possible and what possibly might happen. So then how do we begin to pre-plan? How do we become much more proactive in what we do to explore these things, not in a reactionary way when the trauma is deep and folks are just trying to survive and keep the lights on? It's really hard to make decisions under that kind of stress that are visionary in many ways, because that's what we're asking folks to do in climate change. Adaptation is to really think forward and really future cast. And so how this relates to pandemic and some of the opportunities that are coming out of this is that in some places like Raleigh, which has resources that a lot of communities don't have, but there are increases in participation in city council meetings and commission meetings because folks can tune in, turn the camera off, and make dinner, right? While they're being an active citizen. And that's a change. That's a huge change. I don't have to figure out like my childcare situation to go to a public meeting to be an active citizen. There are all these other ways to listen in and provide feedback now. So that's another layer when we talk about team science, or to the couple questions that have hit, is how do we bring in those folks that are data specialists, so they're not only on the communication side, but also we can start to get some data points from what folks are saying and try to make sense of that. Because even in Zoom transcripts now, you can go in and code transcripts because you actually have a real-time archive of the conversation and you can find patterns, right, in the response rates. That we couldn't do that before. We had to have somebody transcribing on a Post-it note. And so I think it's adapting with what we're seeing and responding to it the best that we can. And we can even do this in specialist meetings, you know, like team meetings. It doesn't have to be with community. We can do this in our own workshopping as the kind of expert team that's trying to get at the issues. And so I think that geographic boundaries, as Amanda pointed out, they're not a problem. We can overcome time zones now. If there's somebody doing amazing work in Singapore, if you can schedule that call, you can probably get that conversation. And folks are more flexible because there's no commute. There's no, they're at home already and doing everything from home. And so I really think it's about seeing the opportunity amongst all the other challenges we're facing right now is to find time to be reflective and opportunistic. And that can be hard sometimes when we're dealing with heavy issues, but I think that's incumbent on everybody that's kind of in the climate realm is to, we probably wouldn't do it if we weren't optimists, because it's too heavy a subject matter if you don't see some optimism in it. So I do think we can, smart devices are amazing, you know, and finding a role for them to actively use as a collaborative tool is key.
Yeah, no, you started that off saying maybe you weren't the most well suited to answer that question, but I think you answered that beautifully. So we've got another question rolling in from the audience that's saying that risk, be it fire, flood, earthquake, or sea level, keeps bumping up against at least two things from the public perspective: understanding the odds or return interval of the event happening, and property. People want to build back what they had and where they are, but it seems to take repeat events until they consider buyouts, and costs also get prohibitive. The pandemic isn't helping with any of this. Are high-risk areas being targeted for help in any way? And I can provide clarification on that if anyone needs that, but maybe Amanda, you could start us off talking about that.
Yeah, I think there's a lot packed into that question and a lot of really important stuff. So I'll try to answer at least one piece of it, which is about highly vulnerable areas and rebuilding. And I'll provide a little bit more info about my background, which is I have one foot in the academic world. I have a PhD and I'm a social scientist and a big nerd. And then I have my other foot in practice. I'm an urban planner. I worked as a planner before I got my PhD, and I now work in government. And the additional layer might be that I'm a parent. I don't know if you guys can hear my baby crying in the background. But what I wanted to say about buyouts is that, yes, this is, I wrote a dissertation on buyouts and why it's complicated to target them, because buyouts are a benefit that come with drawbacks. A buyout is a loss for a community, even though it might be a gain in terms of resilience or reduction in vulnerability or risk. And so we don't want to throw buyout money at wealthy white communities that have a lot of access to resources already. And we also don't want to just throw them at low-income communities of color, because it breaks apart communities. A big buyout breaks apart social networks, breaks apart communities, and it's a loss. And so I think like the very first thing about buyouts is just honoring that buyouts look a lot of different ways to different people. And I know Andy's done some tremendous work on buyouts and can speak to all kinds of community perspectives about buyouts. But from a government perspective, I did want to say that there's a bunch of different pots that fund buyouts, pots of money, and they're actually administered by different agencies. Would you believe it? It's quite a bureaucracy. And we try to align our programs well so that people aren't sort of choosing from one or the other, or picking apples versus oranges. We try to make sure we're making the same offer to everyone. But I will say that my agency has did a lot of digging through data to try to identify some smaller areas to offer buyouts. So we've offered buyouts in maybe like 15-ish areas in Eastern North Carolina that are smaller than cities, kind of like neighborhood or smaller, in some places just a few blocks, to try to reduce risk in a way that's meaningful at an aggregate level. So depending on the level of participation, it may be possible to pull some infrastructure out or to relieve the city of some of its maintenance responsibilities, but also to deal with the checkerboarding issue, which is kind of like a social, I mean, it's environmental and it's social, in that a neighborhood that has a lot of vacant properties often doesn't feel safe to the residents, and it creates a sense of sort of disinvestment. And so trying to, instead of having a lot of buyouts spread out, trying to concentrate them in areas with the greatest amount of risk has been our, it's an approach that we are taking with this program, and we are learning in real time how well it's working as we see where applicants apply from, because it's a voluntary program. I did want to make one quick note about both team science and the co-production of science, just building on a few previous comments. And I can say this in the context of buyouts, I can say it in any number of contexts, which is that consider who's on your team and ask who is the user of this science. So when we take an approach to co-production of science, I think that sometimes, and I say this with total respect because I have an academic background, but I think that academics sometimes overstate their relevance to decision makers or to residents on the ground. And so I would just plug for team science and co-production of science means more than just sort of consulting or communicating one way with residents or decision makers, but it also means crafting the question, crafting the research question with them, so that it's a question that they need and want the answer to, rather than kind of, and it's difficult because it's at odds with the value system at play in academia, which is about novel information and academic publication. So I acknowledge that there are difficulties with it, but in terms of impact on the ground, the idea of figuring out who's an end user of your science or of your project. And this is something we do in our state agency, and including them in the design of your research or your program or your intervention, and in its evaluation. Those are critical means by which we get impactful science and knowledge out there.
Thanks for that great response, Amanda. I'm unfortunately going to have to dip out now for fluid mechanics class. I'd rather stay here with you all, but I know it seems like we have some great comments to go off that, maybe with Andy, and Jin will be now your co-moderator. So thanks, everyone, and I'll see you.
So Kristin, do you have anything to, Kristin, do you have anything to add to the comments that Amanda had just made?
Amanda is so well spoken, and I just really appreciate it. And I think I can echo what you said about the importance of early and often engagement with users. And that is really part of a cultural shift that we're starting to see at USGS, and our risk work again really emphasizes, it's in our plan, engage before, during, after, and even after, to emphasize that importance of evaluation. And some of our projects, to the point about team science, some of the projects that we've supported over the last couple of years have engaged new experts in usability, user experience, and user interface, where we're starting to embrace that expertise to say, okay, well, we developed a decision support tool. Is it actually having the effect that we intended? If not, why not? Or if so, are there ways that we can improve it? Are there ways that we can incorporate the needs of stakeholders as those evolve to advance these different tools? And so that's something, it's hard to do at scale. And yet what we find is that there's a lot of payoff for making those types of investments. And I think we're seeing a lot of excitement in that field. So thanks for the great summary of that, Amanda.
So before I turn to Andy Fox, so there's a question from the chat related to team science. I was also interested in how people engage with different disciplines, the challenges of both trying to do team science in the post or ongoing disaster setting, and also speaking across discipline specific languages and approaches and methodologies. Do you have anything to elaborate on that, Andy Fox?
Yeah, I guess I'll start with the jargon. Yes, we, depending on the field you come from, you probably have a way of speaking to your work. And then none of that makes sense to anybody that is on the ground in terms of the lay public. And so we've tried to be very thoughtful and very, we scrutinize every word of our work to try to make it plain speak. And so Amanda talked about some differences between private, practice and academia. That's a big one, right? Because academic literature has a certain goal in mind, and that's expertise. And so the words you use are loaded, right? Intentionally. Well, you need to kind of unlearn that to be able to, and again, Amanda's point about audience, who is your audience? Is it a room full of other scientists? Then that's got one messaging built into that, both in terms of the words you use, the graphics you choose, because of their level of expertise in that area. If it's decision makers, whole nother set, you need a different storyboard. And then if it's the lay public and residents, you need a whole different storyboard, right? So you one approach will not work across multiple audiences. And so again, thinking through that is really important. For our work related to buyouts and post disaster work, we're really big on longitudinal work. Is we are committed to the places we work as long as they invite us back. It's a promise we make, and we'll fall on the sword if we have to. And that's with grant funding or without. When we make a commitment, if the grant money runs out, something's needed, we'll still answer the bell to the best of our ability. Again, these are places that are struggling. They're suffering. They're survivors. And so when you have capacity gaps and you've got small staff, right, that's trying to keep the lights on, like, how can we best serve you? And so the concept of, I don't know if folks on the call be familiar with servant leadership. We're really about servant service in that way, in an academic role. And I think that's key to a land grant. Again, working for NC State, we're a land grant institution. Part of our mission that drives us is serving the constituency of the state of North Carolina. And every, of course, state has land grants, cooperative extension agents out there doing amazing work. So it's kind of connecting to those types of folks who are deeply engaged because they live in the communities in which they're working. We refer to our work as longitudinal engagement, not deep engagement, because I don't live in that community. I'm not a survivor of that disaster. But I'm here to help, and you guide me in how we can help with my disciplinary knowledge. There's a lot of things I can't do, and I can only help you do one thing. So setting expectations is essential to the work you do too. So whether that be in a team setting of a group of researchers, scientists, practitioners, or if that's working with a community, is set expectations accordingly. Folks typically will really appreciate your commitment to them and their community. But if you don't set expectations, then even if you develop something great, folks could come away disappointed because they had a different idea of what it was you're going to do. So language, words are power. So be cautious and careful in what you do. Commit and be there. Be true to your word. Be authentic, and then just figure out ways, multiple platforms, how to work across different audiences.
Yeah, those are great answers. Thanks, Andy. So we have another question. Could a new administration be proactive by creating a resilience response agency, something other than FEMA that could integrate much more than just response and recovery. So I'm going to leave it to anyone who have some comments on this question.
Do any of the non-feds want to start? Otherwise, I can take a whack at it. Hi, Arantazu, it's nice to see you. So I think sometimes we all think about like, wow, what a new agency, if it was focused on, you know, this particular area, could do. And the short answer and to your question is I don't know if that would be beneficial. Creating new agencies is difficult. So what it might be beneficial is to think about how to better create policies that are focused on resilience and community resilience. And I think that does exist already. And I think one of the big steps in that direction that we saw several years ago, a long time now, was the creation of the National Disaster Recovery Framework, which for the first time really laid out how does FEMA, and in partnership with other federal agencies, support recovery. So kind of thinking about that later part of the disaster life cycle. And that framework was first put into practice in the aftermath of Hurricane Sandy. And that was the first time where a cabinet level working group, the Hurricane Sandy Rebuilding Task Force, was put together to essentially incentivize and require the different federal agencies to work together to execute multiple recommendations that came out of that group and that were part of in placing all the requirements that are part of the recovery framework. And there was a heavy resilience focus on that to the point where in 2013, it was this buzzword across all of the Sandy related meetings that there was real focus. That's faded a little bit. And I think as we start to see the impacts of the COVID experience on our society, on our economy, on our policies, in addition to these compound events that we're all experiencing, I think we will hopefully see a renewed focus on resilience and bringing that really into the policy arena at a much stronger level.
Can I add to that point? I agree with you, and again, I love all of your comments, what you have said in answering all of the different questions. I agree with. I don't think that I don't have an answer for if we do need to create a new agency for resilience. There's a lot of other initiatives similar with resilience, emphasizing in resilience. We can modify FEMA. We can make it more flexible, less bureaucracy, for example, perhaps more effective, talking from the Puerto Rico point of view, right? But I don't know if you have read the latest report that the same FEMA did, analyzing the response and phase in Puerto Rico, and they gave them a D, right? So it failed, literally. Obviously, we can talk about that in another in another webinar if we want. But in my expertise and in my experience, I'm making two different approaches. I heard Amanda talking about end users. I had different projects that are funded by NASA, very scientific, very technological research projects working with satellite information. But I also have other projects that are more community-based that we're working. So I'm having two different end users, if we want, right? I'm using Amanda's. And I think that working with resilience is similar of what I'm doing with my research, right? You can work at one federal level with resilience, with an agency. You can have FEMA, you can call it whatever you want, but we need to work it at the different scale as well, right? There are many other initiatives that are being raised and born from the communities working with resilience. For example, I've been working with 7 rural communities, disadvantaged communities in the central mountain regions of Puerto Rico. And these communities lack of medical services right before Hurricane Maria, right? So they came to the medical science campus asking for help in order to help them to develop access, to obtain accessibility to medical services. And then all of a sudden, 2 months after, it came Hurricane Maria. So it changed everything. So we started working with them, and the first thing that we did was working, trying to provide them medical attention, medicines, and supplies. But then we were able to build with the community because they knew already what they needed, and they were bouncing back and stronger, right, than before Maria. They were searching for medical services and help, and building a health clinic with the state government, with the federal government, and with the municipal government for more than 5 years before the hurricane. But then all of a sudden, we'll build this network of NGOs, academics, and community-based organizations. And in less than 3 months, we built a public community health clinic in the rural metro center of Puerto Rico. This is the first one, and it's completely free, and it's providing health services for 7,000 people. Then we addressed the health services problem following what the community was looking for. Then we were able to submit our proposal because the community, as Amanda and Andrew were talking, they have the knowledge, they have the capacity, they lack of the resources, and they lack of access to resources, right? So that's one of the main issues. So we help them to submit other proposals to other NGOs to create another programs related to public health, and they
I think Pablo just froze. Let's give it a moment.
each community in the region. So we are dealing with with the disease management. We are dealing with public health and prevention, if you want, with the health promoter program. And the other thing that they were looking for was improving socioeconomic development situation. So this is a very rural place in Puerto Rico. And one of the strengths that they have is agricultural activity. So they want to reactivate the agricultural activity in Puerto Rico. So what we did, we submit another proposal to the department, to the USDA. Again, we're not asking, perhaps they lack of the technical and the details and the bureaucracy of what is needed to submit a proposal. But I think that academia and the federal institution and some other can help the community to overcome these processes, right? So we submit another proposal to the USDA, and we obtain another grant to promote an agrotourism program. So they want to reactivate the agricultural activities in their land in order to keep and to improve socioeconomic conditions. So we're working with management, and now we're working with socioeconomic, the community residents in rural disadvantaged communities in Puerto Rico, right? So I think that resilience is beyond not only looking at the federal or state level from the top to the bottom, but we can see it from the bottom to the top. And this is amazing because this community have done this without any dollar or any cent from the government. They are managing, I don't know, I don't want to say how much is the budget right now, but they are so proud of what they have been doing in less than 3 years. That it's something amazing. You can look for it. The name is COSAO. I can put it in the chat for all of you if you want more information. Building resilience, we can see it from so many different perspectives. That again, I think that changing FEMA or modifying FEMA with more flexible actions, I agree. We should do that based on our own experience. We definitely look forward to that. But again, I think that there are so many other opportunities that we need to promote that are occurring, and they have the force to do it. So that's it.
Yeah. If I can just quickly jump in on that, because that's our experience too, Pablo, is two things related to that great example that you gave. One is the importance of NGOs, or in our case, it's been foundation money, and I think that in the post-pandemic, those groups have filled the void there's been a failure in terms of the larger federal response. And so I think with the very long timeframes associated with recovery, that those groups are essential. And when you talk about potential effects of the pandemic, I worry about the drawdown in those groups, or reprioritization of the funds as it relates to now maybe pivoting towards pandemic instead of disaster recovery and making very hard choices with limited resources. But NGOs, philanthropic entities are so critical to this discussion. The second point related to being ready when opportunity presents itself is, again, back to proactive planning. Is you need a blueprint, and then when the opportunity presents itself, you can point to what you want to do. And so I'm biased because I'm a designer, but I think that I think having a course of action laid out when folks aren't struggling or hurting, and they can think differently based on what's going on, then they're ready. You can ask for it in advance of whatever the next disaster or threat might be. But in the case that disaster does strike, then you also are ready. If when you get this kind of influx of investment, then you're more prepared for that. And our work, that's where we're trying to go with all our work is to get from recovery into proactive, or reactionary recovery into proactive planning. And so we're just getting to that because we're now that many years out of Matthew and Florence, and luckily a collective sigh of relief in North Carolina this hurricane season based on what's been happening to our good friends, you know, in the Gulf Coast region. But yeah, to get ahead of it and have a new policy and BRIC and other programs that are looking at this, but is to get out in front, make investments, proactive investments, because they cost so much less. And then again, we could just have amazing, not communities that survive disaster, but thrive perpetually. You know, that's the goal in that. And with that, I'll turn it over to Amanda, because she's part of a new effort like this that might be a good model to answer that question.
Thanks for that lead in, Andy. And this is a question, the question about, you know, something new at the federal level makes me think about what is the role of the federal government in building resilience. And I don't think it's a question we totally have the answer to. Like, ideally, what would it be when so much of resilience is grounded in the local conditions? And those are social conditions, they're environmental conditions, land use policies, you know, any number of kind of local factors, but often our communities don't have resources to kind of take the next step. And I think something that Pablo was talking about that really resonated with me is knowing how can we, and I sort of say this, I asked this question about federal government because we're asking it of ourselves about state government. How can we help communities have their ask ready? How can we support communities in knowing what they want when the money becomes available? And so what we're doing is a program that we're calling the Resilient Communities Program, where we're providing technical assistance and kind of facilitation and some leadership training to regions in Eastern North Carolina impacted by Hurricane Florence, but kind of expanding a little bit beyond that as well, to develop their own set of their own understanding of their risk and their own priority projects that they want to move forward. So that could be construction projects. I think that can be the first thing we all think of, but it might be communications campaign, or it might be a business continuity program, or it could look any number of ways. And that's sort of where we are landing with respect to, you know, what is the role of state government? You know, on one hand, we set some relevant policies, and we have our own assets that we need to think about the resilience of. For example, transportation. We're very heavily, you know, invested in the capital infrastructure of transportation. But then what is our goal? What is our role on the other hand with providing resources to communities to do their own great work, because they are the experts on what they need and how they can get there. And so this is how we are threading that needle currently, is providing those resources. And I think that's something that a role that the federal government might take on whether it's in FEMA or if it's in an agency that has more maybe community development background or economic development background, is to provide support for communities to kind of craft their goals. Because sometimes that takes an external facilitator. Sometimes it takes some kind of other process or resource that isn't nearly as, typically not as expensive as actually rolling out whatever project you need, if it's a health center or if it's a, whatever it is that you need. But often communities need some upfront support, whether that's financial resources or process support, to actually figure out what it is they want, get it on paper so that they can ask for funds for that. So that's what we're trying to do. And I think it would be great to see the federal government provide some support in that respect.
Thank you, Amanda. I think we're about time to finish our seminar, which is a great discussion. And thanks everyone for joining this seminar. And thanks Kristin, Andy, Pablo, and Amanda for your great insights on this disaster recovery. And I want to let everyone know that the recording will be available. We'll be posting in our Southeast Climate Adaptation Science Center, as well as emails to all the people who register for this seminar. So again, thank you, everyone. Thank you.
Thank you.
Thank you.
Thanks so much.